Hello, this is Eric Bergman from CMSA Chicago. Welcome to another episode of CMSA Chicago Member Spotlight, our informational video series by members about members discussing the various specialties in case management. Today, we're going to put the spotlight on Connie Sunderhaus, former CMSA Chicago member and former leader of CMSA National. Connie currently is Vice President of CXJ Corporation and Managing Consultant of the Healthcare Group. The company offers educational programs, product enhancement, and management consulting in case management arena. Connie has authored numerous articles and is a national speaker on topics of case management, public policy, communication, and patient advocacy. Connie has served on the executive committee of the Case Management Society of America and chaired the MSL and international committees of CMSA, active in the community. Connie has twice been elected as to the local board of education, and she served on the board of directors of a countywide service organization, the People's Resource Center. So welcome, Connie. Thank you for joining us today.
Good morning. Good to see you.
So why don't we start off with you telling us just a little bit about yourself and your career path and what led you in your role as a case manager. I'll note that you're now comfortably retired to Las Vegas, which some of us are quite envious of. But maybe you can tell us a little bit about how you got there and what you plan to do as you relax into your retirement.
Well, the relaxing part is just beginning because in the last couple of years, everything's been focused on the move to get here. So I think we're just beginning to see the relaxation part, other than enjoying sunshine and blue sky, which I won't rub in too much. For those of you in the Midwest.
Well, I have sunshine and blue sky right outside my window, but a lot of snow.
Yeah, but no, don't have that. I can see it on top of the mountains. I was thinking back of as I prepared for this conversation and, how I got into case management when I didn't even know that's what it was called, or not many people even had a name for it. Way back, nursing school, I worked we all did our stint through different departments, and I was working in the clinic or outpatient departments. And I remember an instructor saying to me, you should really be a visiting nurse or something because you like to connect people to things. And that made me look back kind of my whole career, which has gone in multiple directions, as many of us have done. And it's always been about connections and networking. So starting from then, which I didn't heed her advice that I worked in the operating room because I just thought that was just a neat place to be. And then ended up working in home care and off and on over the years. And that was led to, like almost 30 years ago now, working for a home care company that was new to the Chicago area. And we was called a community liaison. And essentially it was kind of sales. It was getting people to know this particular home care agency and how wonderful it could be. And but at that time, I was able to actually establish a case management role that led me to be able to sit for the certification exam. And our roles then was we really got to know some of the hospital discharge departments, as they were called then, or social work departments, and sat in on discharge planning meetings with the staff, did chart reviews, coordinated getting people from the hospital to home and what services they would need when they got there, getting benefits applied to all of the things a case manager really does, but I was working for an external company. The rules have changed on a lot of those things since then, but that really got my foot in the door and kind of always steered towards some sort of activity that led me to be able to do coordination, which is, the biggest part of what a case manager does, and connecting with patients that way.
Well, tell me a little bit about how you got so involved with CMSA. I know you were among the founders of the Chicago chapter, right?
I wasn't one of the founders. That had already started a few years before I joined. And what I was told, it's kind of interesting because many people don't know that one of the history was you were sales, which technically I was, even though I was an RN and certified case manager, you were considered a B member. So you weren't given the full rights and opportunities within the organization. But I had a very wise social worker chapter president named Robin, whose last name escapes me right now, who thought it would be great to have a liaison of the B members on the board. And that's really what got me involved with the chapter. And then it snowballed from there to when I became president. The national organization eliminated this B member status. And I started going to the national conferences. And next thing you know, I had a call from a nominating chair to run for office. I was treasurer. So I was treasurer for a few years. And then I think I took a year off. Then I got back on as vice president and then again as treasurer. So, excuse me, I was 6 years on the national board and chaired a committee or two then, and then stayed involved through some committee work, public policy primarily. So being involved on the national level. So all of those things combined, local and then getting into national, I was deeply entrenched in CMSA.
Well, I always remember you because when I first became a case manager and didn't know what I was doing, and my employer didn't know really what case management was, I found CMSA and went to a meeting, and there you were. And you and I knew each other from our outside, political activities in our own community, but I don't think I knew you were a nurse, and I know you didn't know I was one. So it was sort of a fun.
Right. I remember that encounter. It was like, Eric, why are you here? So but that's always fun. And I think to kind of quickly to the chase here is CMSA has such an impact on me professionally because it led to so many other opportunities. And that was the public speaking opportunities when was doing quite a bit of work for different pharmaceutical companies who would put on education programs. And I was on several speakers bureaus for that. And that was always interesting because you worked with those companies to how would the piece that they were wanting to educate case managers about. Of course, naturally it was, how their drug would work, but that wasn't the part that we played. And when they had case managers on their bureau speakers, it was what's the important part of this condition that the case manager needs to know, and what does the case manager do with that particular bit of information? How could we, because I always felt that case managers, and I'm certainly preaching to the choir here, you might work all the time in OB and pediatric patients. That might be your main focus. But guess what? Your colleague's on vacation and you got to fill in and help. And maybe you haven't had a patient with COPD for a long time because you don't work with the adult population. So, how do our programs and things that I've done since have always been, how do I provide the information that the case manager can use when working with a patient with a particular condition? So that was one of the things that CMSA led me to a whole change in my career and doing what I had been doing for the last, say, 10 plus years.
Well, tell me a little bit more. And I know that you got into writing and did a lot of educational work and you certainly mentored me quite a bit and helped me into, some tremendous roles at CMSA and have just tremendously broadened my career and my outlook on things. So what were the latter years like in that educational role and mentorship role?
It was a combination of things. Some of it was the speaking engagements that you mentioned and having that opportunity, and then led to working with case management software companies. And I did it one time as an employee, but most of the time it was as a consultant and coming in because they had put together, meaning the software company that provider, that company that was going to various companies that worked with insurance companies or whatever, or even hospital systems or outpatient systems, providing the skeleton piece of case management, which meant uh, the care planning piece. So it would be, I put together, was mostly chronic conditions. I did this for TriNet at one point, and uh, one of the companies out in Boston, it was a hospital-based uh, insurance company where they managed some of their own patients under their network. So it was the entire piece that wasn't the actual software and designing the development of that. That was not my thing, but I get provided so let's use CHF as an example. Was here's the assessment for you, here's the potential goals, here's potential interventions, and then what pieces would come out of that, and here's the patient education piece. So it would be everything they would need if they were working with a patient with a chronic condition. And it was primarily chronic conditions with a few other types of things worked over the years, depending on the client. And that was really enjoyable because I got to sort of work in the background and then bring up the things that a case manager would need to have in order to work with the patient. So some of it was a pull-out piece where he was reminding the case manager when she's using the software, oh, I got a patient with this disease, tell me again. So we had an education piece for the case manager and then the education piece for the patients. And the patient education piece has been something I've been doing for years. And it's always been uh, one of my favorite things.
Oh, that's great. Yeah, it's one of the things that I talk about sometimes when I'm talking with people about case management is we talk about how we left the bedside, but we're still connected with the patient, and it seems to me that most of us, especially us nurses who are at the bedside, are really drawn to that opportunity to maintain the contact with the patient and to help further the education of patients. And it sounds like that's a lot of what you were doing.
I had the opportunity about 20 years ago to work for a patient education company and learned quite a bit from the person that designed the company and about health literacy. And then I continued working in that area and learned myself, more and more, how to compose educational pieces for patients. What would make sense and how can that be delivered either a worksheet for a patient or for the case manager as he or she is working with the patient over the phone. So it didn't have to be, it could be in person or it could be over the phone or it could be sent, that it was done with the appropriate literacy level, following the particular guidelines of that condition, and how to make it useful for a patient and also brief. I was big into one pagers.
Right.
Here's what you need to know, and here's where just that type of thing, and that's what I enjoyed, and I still do. I still
great.
kind of like to look at it from that perspective.
Well, that kind of leads me into my next question. I know I said at the beginning you're retired now, but I suspect, knowing you, that you're not exactly going to just sit back and watch the television and eat bonbons, right? Do you have
No. I teasingly told Eric earlier that looking at my day, it's read newspapers over several cups of coffee, but then I go in and read all the newsletters that I get from different healthcare entities. So I can stay somewhat alert to what's going on. And actually, over the years, which I didn't mention before, I've done work comp case management. And usually it was always the PRN person. Can you cover the appointment for me? Or a few times I'd manage the whole case, but most of the time it was filling in and being able to jump in, know what to do, know what information was important to get back to the adjuster, to the person managing the file, and understanding where the patient needed to do next. And understand, and that could be varied. Anybody that's out here listening that does work comp work knows that could be from a patient that's very interested in what you could offer them to move along, or they just totally resent the fact that somebody's getting in their business. So we've
Yeah.
all had that. So,
Oh, sure.
um,
Absolutely.
and there's I'm probably going to be doing some of that here. I've already connected with the companies, already reached out to me to see if I could help them out here. So I'll probably do that. Uh, so that's, again, it's the connection. It's really knowing what's going to help a person in their next stages or their next steps of getting back to a healthy life.
Well, one of the things we've been trying to focus on in these spotlights is really the role that your professional organization plays in developing your career or in supporting the kind of work or life that you built for yourself. Can you briefly, as we wrap up, tell me a little something about how your involvement with CMSA kind of shaped you and led? We touched on this a little bit at the beginning, but
Right, we did. And then that was some of the opportunities that I found for myself professionally. But it all comes down to networking and connections. And that's some of the benefit when we were having the in-person meetings. And it was the one thing to tell yourself is to not be shy. And that's kind of hard when you were, I guess when I was brought in, the case manager that actually took me to my first CMSA meeting when it was ICMN, Illinois Case Management Network. Just for those history buffs out there, that's what this particular chapter was called. Uh, she said, whatever you do, don't talk. Don't tell anybody what you do. He was like, oh, okay. So once that became a little bit not quite so awful, like you had cooties if you were, did anything related to promoting a company or bringing knowledge about your company or doing anything like that, which is totally ridiculous. Uh, so anyway, once that happened and I was given that opportunity to join the local board, and we did have committees, quite a few committees in the chapter at that time. It was joining things. So I would encourage those of you that are listening to this but aren't involved, you don't have to get involved and be an officer and go the route that I've done and Eric has done and really taking on responsibilities in the organization. But join a committee, help out on a limited time, volunteer when there's an opportunity. And it's amazing. You get to make lifelong friends. And there's, professionally, it can do wonders. But I find, I should say and instead of but, and that I found that I was more able to do that type of thing in my personal life. And where connections and networking make such a difference. So learning, I kind of just think of when you get to know somebody through an organization or a club, well, who do they know? What's their specialty? Where could they be of assistance to you, or where can you be of assistance to them? Sometimes their families don't like being case managed, or as my husband has told me, I'm not your patient. Uh, well, have you thought of this? No, that doesn't always go over so well. But always thinking of how that connection can be made. And if you know something, you share it. Have you learned about X, Y, and Z? Of course, naturally, people now are talking about the vaccine for COVID. So, I try to find out what I know about it. And just earlier this morning, talking to relatives, what do you know if this just happens or that happens? And I'm the go-to person. But that it doesn't mean because I'm a nurse, it's because I happen to read more things and kind of can figure them out.
no, but
So
it's because you're a case manager too, and you're in tune to those things too.
always thinking of who could I connect? This person is here, this person's there. Maybe I should introduce them. Maybe they could meet that there's a common interest, a commonality. And as nurses and as case managers and social workers, it's all about, you go back to our patient interactions, it's all about making that connection with the person at a level that's comfortable for both people. And then it goes, if you're helping them as a nurse or a case manager or social worker, you have goals in mind that and you you work with the patient to see what their goals are and how can we make that happen. So it's the same thing in life. And I think I owe quite a lot to CMSA because of that.
Well, it's just inspirational. Thank you so much for the time, Connie. It's been
You're
really
welcome.
talking with you.
It's
And
been fun.
we'll continue our spotlights, and maybe we'll find another opportunity for you to come and talk to us about mentorship or patient education or something along those lines.
We'll do.
All right.
Thank you.